Hello everybody, it's a pleasure to be here with you with this first global meeting. We are going to talk about the balance between the donor and the recipient area, especially when you perform the FUE technique. The donor and the recipient area, in my opinion, it's very, very important when you see the patient for the first time to explain to the patient the limit of the surgery, the limit of the surgeon, and also the limit of the capacity of the patient to have hair to cover the area they want to do, especially in young patient. You have to know and explain the patient the coverage is achieved when 50% of hair will start. How do we protect coverage from a surgical procedure? You need to know the hair density, you need to know the hair diameter, calculate density, surface area of loss, and also the hair length make the difference. Also, the hair characteristic in the donor area, it's very, very important to see the caliber, the density, and also the hair angle and the direction of the hair. Sometimes it's different from one patient to another, and also sometimes it's different from one area to another area in the same patient. It's very, very important to study the hair before the surgery. You have to do the follicoscopy. You have to use a device like that to see the caliber and also the characteristics of the hair. Sometimes the patient has a very fine hair. It's not a good candidate for hair transplant. Sometimes the patient has a medium hair. It's a good candidate. And also sometimes the patient has a coarse hair. Well, fantastic. But it's very, very hard to extract. You have to have a very good device, and also you need to have some skill to perform this. Also, how to calculate surface area. You have sophisticated softwares, and also you can use a very simple method like a grid method, which we use in almost 100% of my patients. We use a silicone sheet, which I learned with my friend Uzur from Ankara, Turkey, and we do this all the time, and almost is very, very, very accurate to be sure. Also, John Coe has a study, and he found the average donor area in the patients are around 3,700 grafts. And if you have in mind, you have to take care not to remove more than 30% of the grafts from the donor area. It's not easy to have more than 4,000 grafts. You have to have this in your mind. You have to explain to the patients. Sometimes you need to use a bird, sometimes you need to use a body hair. And also, Erdogan and Lorenzo did a very good study about the coverage value, where the total number of the hair by square centimeters plus hair diameter in micrometers. The minimum for coverage is 5.4. It's very good study, and you have to know about this. Also, this explains why in some patients you have some different results with the same area of the hair loss. In summary, to protecting the coverage, you need to know the quality of the hair affected, how much we need to go, or we can go. The quality of hair affects how much we can go. The donor area is not permanent, even though it may be considered relatively safe. You have to take care about this. In my opinion, diameter is the most important influence factor on coverage. That's why we have some result, or why explain some result in a patient who has the same area with less than 2,000 grafts, like this patient, you have a very good result, a consistent result. Even if you wet this hair, you can see the result. You can see the density, the quality of the surgery. You can see the hairline, the natural of the restoration of this patient. Also in this patient, almost with the same area, we need almost 3,000 grafts to cover this area. Why? Because it was a fine hair. We need to put more hairs per square centimeters. You need to put hair closed, and this took more time, took more grafts, and that's why in some patients we have some different result. In my opinion, the hair diameter is the first thing you have to look and to take. What I can say is thank you very much for your attention of everybody. It was a pleasure to be here